Good afternoon, everyone. My name is Ron Najaski. I'm CEO of Emery Pharma. Welcome to another Emery Pharma Speaker Series. Today, we are honored to have Dr. Paul Harmon. Paul and I basically spent a few years at University of Pittsburgh, different time. I was in the late 70s and he was in the early 80s where he got his PhD. He did his postdoc at NIH. After a couple of years spending time at Liposome Company, he joined Merck and Company, and he spent 22 plus years at Merck. I don't know anybody that spent that many years at any company. So good job, Paul. And now he's consulting, and he's one of our consultants at Emery Pharma. Where we got in touch was around the generation of nitrosamine in different drugs that have really come up in the last few years. Obviously, I recently presented on nitrosamine and what happens, the risk analysis around nitrosamine. And we're very keen to learn more about nitrosamines from Paul. So if you're interested in nitrosamines and how they're generated as a process impurity, as different ways during the stability, this is a place to be. So thank you for joining us. With that, I'm going to let Paul present. Thank you, Paul.
Thanks, Ron, for giving me the opportunity to share with Emery Pharma these two papers. You can see their titles down here that I was able to publish last year. I should point out that while I was with Merck for those 22 years, I never thought about for 1 second in any way, shape, or form a nitrosamine in the current context at all, and had no experience at Merck at all with nitrosamines. Rather there, I did stay deep in the lab, never stepped out of the lab, and published as many papers as I could around oxidative degradation, around how excipients could induce all kinds of reactions in our drug substance, and amorphous solid dispersions, all kinds of things, which were really much fun. In 2016, I retired, and it was only a number of years after that retirement that I ran into nitrosamines in the context that you all know. And in seeing that topic come, I felt that at one point, not too long ago, I could make these contributions right here as you're reading here. And I should point out that at the time, I was not capable, didn't have any lab access myself. So none of these measurements are my own. And this is all just kind of sleuth work, detective work of looking at what was unexplained. This is all in drug product, I should say, or in the case of ranitidine, it actually is the drug substance, but not the manufacturing process. This is just all drug product on stability is what I'm looking at in these papers. With that, I think it's best to start out, as I'm going through here, with the formaldehyde paper. Seems to be the one that would make the most general sense to talk about first. And in starting with that, I really need to highlight that I should point out that some of the practitioners in the field found this paper, I think, unsettling is a word that is fair, and I think that's a very reasonable reaction. And when I thought about how to frame this work, I thought, if I can't explain why anyone would be unsettled by this, I'm not giving it a very good context. So as I developed these first couple slides, I was intent to ultimately come across with the idea of why some folks found this work a little unsettling. So the first 3 slides are trying to get at that, and they're rather wordy, so I apologize for that. As you all know, in the first couple of years of the nitrosamine era, it was all about small things like NDMA and drug substance manufacturing processes. But in the last several years, the concern has moved into, drug product manufacture and storage. What are the analogous things that we can take from there in terms of nitrosamine formation? So it's become really about this term NDSRIs, which you see defined here. Nitrosamine drug substance related impurities. And the one that is drawing the most attention naturally is like, hey, if I have my drug molecule and it has a secondary amine and I nitrosate it, well, that's what we should be worried about in this context. So that's where the concern has largely focused. And in the last couple of years, 2020, 2023 was a difficult time there was a number of voluntary recalls due to these detected NDSRIs. But there was a lot of confusion about what kind of levels are really, should be allowable. Should it be more like these NDMA kind of levels, or should they be larger, higher levels, given that this is such a larger molecule? The relative mutagenicity is not really understood. So that was kind of why these were voluntary. No one really knew what to do. This situation improved considerably third quarter of last year when the FDA released allowable limits based on a potency categorization process. They looked at all the secondary amine products that were out there, or a lot of them. They found 263 of them and said, well, we'll put the nitrosamine group on there on the secondary amine, and we'll figure out what kind of limits are we're going to put on that in this potency categorization process. And that's what they did. Where are we now? Well, it leaves us where we know about nitrite ion, where it's coming from. So we know all about the nitrite ion coming in from the excipients. So that's good. And there's extensive databases on this now. And generally, it's accepted that more or less, general tablet is going to have about 1 ppm nitrate per tablet. So at this time, the innovators of those 263 marketed products are expected to carry out risk assessments as to whether or not these are actually going to form in their products. And if a risk is identified, this is right out of the guidance, the innovator is expected to carry out confirmatory testing with an appropriately sensitive method. And there's a time limit. They're supposed to get that done more or less through all of their products by late 2025. So it's as if they're going to be doing risk assessments on the ones that the risk assessments that indicate the most risk. They want them to test earlier and actually do the confirmatory test. And then as they get toward the end, that'll be the ones that are less risk. And I assume they'll still be doing confirmatory tests. Not exactly sure, but this is a very sensitive area, this risk assessment. It's impacting marketed products with limits that are already now established by the FDA. So that is a rough scenario. So again, pushing that risk assessment idea a little bit more so that we can see ultimately where this work leads is, you start doing the risk assessment, it becomes obvious that there's the secondary amine and the nitrite ion cannot actually react. They're not directly reactive. And so something in the drug product matrix must convert nitrite to a reactive species. Oh, I meant to ask, is this cursor, this is visible to you guys, correct? So something in the drug product matrix has got to convert the nitrite. So the question is, well, how? And this first bullet's highlighting that the only way that that's ever been talked about in the context of drug product is the so-called acidic pathway, which is just the nitrisation of amines in solutions of nitrous acid. And that is nitrite ion plus a proton is nitrous acid. So we're just talking about low pH of the solution can drive that nitrisation. So current risk assessments really only search for acidic causalities if they're looking into risk, given that basically nitrite is going to be there at 1 ppm. So this work that I'm going to tell you about strives to raise the awareness that, look, 50 years ago, formaldehyde was found to be able to catalyze this reaction at neutral pH. And coupled with some of the, 3 of the 10 most commonly used excipients are known to release low levels of formaldehyde through oxidation of their matrix. And further, the paper that I am now highlighting implies that the formaldehyde catalyzed nitrisation is operating right now in solid dosage form and accounts for several of the 6 drug product recalls due to high NDSRI values, and that all risk assessments need to include this new pathway. Given that a lot of folks are in the middle of those discussions with the FDA and have a lot of crunch to get through 2025, a brand new thing to consider like this that could be very significant, I think is giving rise to, it's kind of upsetting at this point to have that kind of knowledge or that kind of possibility thrown into these risk assessments. So that's where that upsetting reaction, I think, is coming from. So now we can get into the basic science of this paper. And this is the outline. Talk briefly about nitrite. Not going to talk a lot about that. Review this acidic pathway as it seems to apply to tablets. then talked about the formaldehyde pathway, and then examined these 6 drug product voluntary recalls. So nitrite ion levels and excipient, this is just from the huge database that has been developed right out of their publication. This is 8 of the top 10 most common excipients. Here are the mean nitrite levels. Yes, there's a lot of variability. I didn't include the ranges here, but the point is, you calculate the typical tablet composition with each one of these used at its typical weight, etc. And it's a general 1 part per million nitrite in a typical tablet composition. So this is a kind of busy slide. I want you to focus down here first. What I really want to do is look at these new FDA NDSRI limits and think about how much of the nitrite in this 1 part per million is actually needed to reach those limits, to sort of relate those two in our heads. So the FDA new limits that they came up with are only in 4 buckets. It has to do with the structure, the local structure, and then the secondary structure. There's a whole procedure that they go through to get these values, and they lay it all out there, and anyone now can take their new secondary mean drug substance and look at these guidances and put yourself in one of these categories where you're first going to be. So the limits are 1,500 nanograms per day, 400, 100, or 26. And the percent of the 263 which fall into these categories, I just walked all through the 263 and tabulated the percents. Well, fortunately, about half of them are at this high 1,500 nanograms per day, so that's good. But about the other half fall 1/3, 1/3, 1/3 at 400, 126 nanograms per day. So this column over here just comes from calculating, well, use a 300 mg tablet, that's going to have 300 nanograms of nitrite at 1 part per million. That just works through, if you take a 300 gram per mole drug, you're going to end up with, okay, 100% reaction is going to be 2,000 nanograms. And all I'm doing here is taking, okay, 1,500 divided by 2,000, 75%. So for the 1,500 nanogram per day, you're going to need to react about 75% of all the 1 ppm nitrite to get to that limit. That's kind of hard to believe that you're going to be able to do that. That's why this is a good number. If you fall here, you're in good shape. The problem starts to become half the time you're only needing a lot less than 75%. Here, 20%, 5%, and 1% of the nitrite that is actually there in a 1 ppm tablet. So there's plenty to do, to get you to these limits, especially these 50% of these, the time, these lower 3 limits. We should note that they have gone ahead and they've further looked at 5 compounds have actually been present enough that they've now gotten specific, even more specific than these. They've done the real assignment for 5 more. And they've all come out at around 100 nanograms per day or less. So the ones they're really specifying even further are actually down in this lower limit. So the next slide, I want to look at how these relate to the ICH Q3B 0.1% reporting thresholds. This is all from the last slide here. All we're adding here as well, okay, so you have a 50 mg dose per day and 0.1%, that's your ICH Q3B. That's 50 micrograms per day. And then we're looking at how much, these are compared to that. And so 1,500 nanograms a day is 1.5 micrograms. So 50. So this is only 30-fold less for this big higher upper bucket. So you're still 30-fold less than Q3B. Not too bad. But you can see how this drops off to 125, 500, and 2,000-fold. So roughly 50% of the time, you're going to be at 125-fold or lower than QCH 3B 0.1% reporting threshold. So these are, significant challenges. And they're low enough that if you don't have a secondary amine in your drug substance, say you only have a tertiamine, but you have a secondary amine degradate, you might still have to pay attention. I mean, a degradate now reporting at 0.2%, that's the ID threshold. 0.2% of this is 100 micrograms per day. If you're only converting 2% of that, that's 2,000 nanograms per day of your NDSRI. So you're all the way back up here to the top of this limit. So you may not be able to just ignore impurities. As a matter of fact, in the last 3 years, I personally know of at least 2 cases They weren't recalls, but they were real-time iterations with the FDA that were both impurities were getting nitrosated and running afoul of, I'm not exactly sure it was these limits. It was probably the original limits before these were set. So I can't say exactly where they were, but still enough that impurities were being considered. So at this point, I'm trying to get our minds back, or down, I should say, into where these kind of reactions might be taking place. And this is just some mind experiments here. Wanted to get people there. It's, in solid dosage form, all these particles are thought to have absorbed microlayers of water, and these microlayers are basically where these reactions happen. So down here, I'm just trying to get at how you can get at that pretty easily. So here's a 50 micron particle, even if it has 0.5% absorbed water, you put the volume on there, and it's, wow, it only has to be 0.04 microns to hold that 0.5% weight, but that's 40 nanometers. Us older folks think of molecules in terms of angstroms, so that's 400 angstroms. So, gee, if you lay 5 benzenes side to side, that's only 35 angstroms. So if you string out this entire width of this slide, that's still only 250 angstroms in benzene space, if you will. And that's not even to 400 yet. So then you think about, well, a tablet has about 500,000 particles on average, depending on some size that you want to use as, an average of the API and your excipients. 500,000 particles like this crushed together by compaction, roller compaction, tablet compression, whatever you want. You end up with a tortuous diffusional network of drug and excipient monolayers. If you want to think about that 500,000 particles, how about a school bus, no seats, no students? That's about 500,000 golf balls. So if you're struggling for thinking about 500,000 things crushed together, a busload of golf balls kind of gets you there. So it's in this crazy, torturous diffusional network that, the drug is going to encounter protons, it's going to encounter formaldehyde, it's going to encounter nitrite. And this is where we talk about the excipient influences on the microlayer pH. Absolutely. So protons can diffuse, and this is where we start talking about, when they do the acidic risk analysis, you start talking about slurry pHs, among other things. What kind of pH values can excipients drive those layers to? And these are very common, 5 to 20% by weight. Just throw the thing into water and you measure the pH. It couldn't really be very simpler. And the data makes sense. The vast majority of these are pH 6 to 7. Sure, cross-carbonyl sodium is a little lower. This is typically used at like 5%. Mannitol is actually low, 5, and used when it is used at significant amounts. So a mannitol tablet could have a pretty low pH, for example. But the rest are pretty high, commonly high. What about drug substance particles? They can change pH too. Particularly, we're doing secondary amines, so we have salts. So salts are often in the form of, H plus A minus for secondary amines. And I'm not going to get into gory detail here, but depending on the nature of A minus and the basicity of the secondary amine, there's easily calculated values the values are easily calculated to show what the pH is going to be driven to in a saturated solution. And reasonable number of times, the most acidic component of the entire formulation is the drug substance particle. Again, that can be easily calculated. And the drug substance salt form is an important part of that risk profile. Now I want to talk about the traditional nitrosating agent in acid that has been talked about for many, many years. And I want to kind of trim it up a little bit as we might apply it to tablets as we've gone through to get to this point. So we're just talking about nitrite, takes a proton, goes to nitrous acid, that's pKa of 3.15. To go beyond this and generate these nitrosating agents, which are typically talked about, dinitrogen trioxide, nitrosonium, nitrous acidium ion, and nitrosyl chloride, you have to have more protons and or more nitric acid. So the first one I want to talk about is this one, dinitrogen trioxide. The points here is going to be not in tablets. And that's because we just don't have nearly concentrated enough nitric acid. I mean, if you think about that 1 ppm nitrite, and you think about all those diffusion microlayers around particles, you use estimates for volumes and such like that. at best, 1 ppm nitrates in that whole matrix is you're talking 0.1 to 0.1 millimolar nitrite in the microlayers as a ballpark estimate. That is way too dilute to even consider this top formation of this dinitrogen trioxide. So we're going to cut that out, not for tablets. Similarly, you have to get nitrous acid here and very concentrated, very low pH, very high hydrogen ion concentration to get this nitrosonium greater than 4 molar. I mean, we can't even get to a pH of 5. We're at 10 to the minus 5 molar. So this is really not happening in tablets in any kind of practical way. In tablets, what's happening is one of these bottom two, which still needs another proton put on the nitrous acid to get this nitrous acidium ion. And in the presence of chloride, this can actually form nitrosyl chloride. I have chloride there because we got a reasonable number of HCl salt forms that are used. And so you can't discount the presence of chlorine in an HCl salt, for example. So these two are really what's happening for a acidic tablet nitrosating agent. And this is just showing that reaction because I kind of forgot to show. Yeah, once you get here, a secamine can just react there, kick off the water now, and get your nitrosamine. This is how they've become activated. If you put that all together, they now have models out there for the pH dependence of nitrous acidium ion. And roughly speaking, this is log nitration rate at some concentration of some secondary amine. I think it's dibutylamine or something in this case. Point is at 1 millimolar nitrite, this gives you the pH dependence. It's dropping off here because you need to be protonating nitrous acid, which has a pKa all the way back up here. So this drops sharply at higher pH. And this is now this little box. This is our tablet pH. This is why we do these risk assessments around acidic excipients, because my goodness, if you're up here, if you have somewhere in your tablet like a pH of whatever, this is like 5.5 there, well, you're almost 30-fold higher in rate than you're going to be if your tablet's out here at pH 6.5. That's a lot. You're going to form a lot less NDSRI out here than, a lot less here than you are up here. So that's the whole point. This is just a summary of the acidic pathway. I don't think we need to go through it, except up until this point, if anytime we see these NDSRIs, we say, well, we must have been accessing low pH enough somewhere because we formed it. And that's all we've ever been, because there's no other way. Now we move into this other way. So this is just now going to talk about the formaldehyde pathway. This was in 1973. Again, this is in solution. We're going to start down here, start at A and go around this way. So you start with formaldehyde, you got a secondary amine, this lone pair attacks here, you all know. You get this aminal product here that can dehydrate here to form the iminium ion, and this is the reactive species. But note, the iminium ion is also back reacts with water significantly. Ultimately, these yields in water are only 5% or so because of this back reaction. We'll come back to that later. But at any rate, we have this iminium ion. This is the reactive species. This N plus here is dying for this bond here to be kicked back so it can relieve that charge. So this CH2 wants to be attacked by a nucleophile, even as bad as this nitrite O- nucleophile. And that's what happens. So I'm trying to show this approach over here of these two. And, lone pair, that electron pair comes down, kicks it back, and you get this nitrite iminium adduct. Now, this would be strange enough, but the really strange part that no one, I'm sure, predicted, but they just discovered, was that this adduct here collapses pretty rapidly. And I show the bonds rearranging like this. I don't think anyone quite knows, but the point is a new NN bond is formed at the same time one of these other bonds collapses and formaldehyde is kicked out, and this species, the nitrosated secondary amine drug is actually generated. And you might think this has got to be, the efficiency of this has got to be bad. No, the bad efficiency of this whole reaction is this back reaction. When they made this back in, and they put it in pure, very high acetonitrile with the nitrite, it collapses into this and collapses this out at like 95% yield in like 3 minutes at room temperature. So these things love each other once they find each other and crash down to this and expel formaldehyde. It's kind of amazing because, I don't know, that's the discovery of science. And the pH plot is actually quite flat. There's little pH dependence from where they studied it. That's 6.4 to 11. Now we talk a little bit about, well, that was, added formaldehyde. Where's formaldehyde coming from our excipients? Well, this has been known for quite a while that certain excipients, this is that same list of top 10 excipients. There's 3 excipients in this top 10 list that evolve formaldehyde: HPMC, povidone, and cross-povidone. And that's because they have groups in them. I didn't list them all here, but they have groups like this that are oxidizable by peroxyl radicals. So this is natural auto-oxidation. And for these excipients, they slowly give off formaldehyde as part of that oxidative process. Here I include a few others which are known to be even worse. And these are typically not in tablets, but they are occasionally, like ethyl cellulose and HPC. Again, they have these same kind of groups, and they evolve continual formaldehyde. So again, formaldehyde at will come in at like ppm levels if you're using some of these top these big 3 formaldehyde producers, if you will. And again, that's going to lead to something like 1 millimolar formaldehyde in tablet microlayers, same as the nitrite rough concentration. This slide is trying to get at, if you look at that keeper and roller data, all their data was really with formaldehyde, except there was one data point that was actually without formaldehyde that was not a 0 measurement, meaning they actually measured enough to put into the paper as a non-zero number. And that was at pH 6.4. If you look at that data implies that at pH 6.4, with nitrite equaling formaldehyde concentration equaling 1 millimolar, that the nitrisation yield from the formaldehyde should be almost 20 times higher than the so-called acidic path at pH 6.4, which is not really acidic. It's just, it has now lowered so much that formaldehyde is that much higher at the same concentration. So what that looks like, if you overlay that data onto this plot, which, I've done here conceptually, this is the previous plot I already showed you. This is the pH 6.4 data point from 1973, sitting here at pH 6.4, and 20 times higher than that was the formaldehyde pH independent yield at 1 millimolar formaldehyde, and this is 1 millimolar nitrite. So this, is what really helped me believe, oh man, if you got like trace formaldehyde around, this is a problem when you're out here at this high pH in your tablet, because now your yields are way up here instead of down on this line. But this is why we're doing the risk assessments, that we didn't know that this might be here, this pH independent line here. That was what precipitated my concern. This slide here is just kind of a bridge between, all that work I talked about is in solution. You're talking about the solid state. So here I just am trying to say, well, there's one thing going for you in a tablet, unfortunately going for you, and that is that you've done a lot of work to reduce the water content and the water activity to as low as possible. So basically you're helping shut down that back reaction. So that's actually going to help some. The other is that, formaldehyde is a gas at room temperature. It's very highly mobile now. So not only can it diffuse through those layers, but it gets out and it spreads around. It's got extremely high mobility. These 2 bullets here are trying to say that there is other papers published out there, like this Waterman et al. Here, where you can look at that and say, wow, he had 125,000 nanograms of this reactive D-iminium ion per tablet must have formed, and going back up here, because he had a degradant which clearly had to go through this. It was not a reaction with nitrite, but something else. And the point is, he must have made at least 125,000 nanograms of that, because he had formaldehyde producing excipients. This was not on purpose, of course. And we only need to react 400 nanograms of something like that drug-iminium complex to get into trouble, if you will, with 50% of our NDSRI cases. That was that slide 7. 400 nanograms is only 0.3% of the 125,000 nanograms that he happened to make under his stability conditions. Again, not intentionally. This was just exploring the mechanism, and it went through that iminium. All right, so now we're down to these 6 cases of drug product recalls. We're going to go through pretty quickly. They're listed here in the kind of order in which they actually happened from mid-2020 to 2023. And we'll take a look at, is there any correlations with any formaldehyde generating excipients in the formulation? What can we say about these? So the first one is metformin, and this is actually an easy case only in the sense that it is a comparative case. I should point out, it was actually NDMA in the case of metformin, but it doesn't matter what, if this is actually an NDSRI or a specific one. The point is here that the problem with the nitrisation was only for the extended release formulation, but not for the immediate release. And the extended release and the immediate release used the same drug form, had all the same excipients, except the immediate release, because it was an extended release, had a lot of HPMC was used for that tablet. And as I've highlighted, HPMC is a known formaldehyde generating excipient. The HPMC itself is not acidic. It has a slurry pH of like 6.5. It's not unusually high in nitrite. I think it was 0.7 or something. So it's a normal contributor to this one. And so, such that the ER tablet nitrite shouldn't have been any wildly different. It all comes down to the differential nitrisation in that case would appear to be formaldehyde generating HPMC. So now you take the second case. So the second case is listed here. This is the NDSRI. There was no formaldehyde generating excipients used. Well, that's good. And the drug, if you do the calculation, the drug will not acidify the microlayers below pH 6, given its properties. But ATAB, this was not one of the top 10 that I listed, ATAB here, does have known to have an acidic slurry pH of 5.2. So if you had to look at this, you'd say, oh, well, makes sense. ATAB is driving the classic pathway of, acid catalyzed pathway to nitrisation. Good. I guess these titles are kind of blocked here. This is propranolol, and it's the same thing. In other words, it's one of these extended release cases is showing the problem. The immediate release is not. They have all the same excipients in the extended, except a large amount of HPMC used for the extended release tablet. And again, it's all the same comments about HPMC, again, suggesting differential nitrisation from the formaldehyde generating HPMC. Quinapril. Again, this is just nitrisation of the secondary amine, and it has cross-povidone, one of the three. None of the excipients are particularly acidic at all, but if you do the calculations on how acidic this drug will drive its microlayer, it will drive it low, and it'll drive it to something like pH 5. So it's certainly possible that the pH 5 is really driving the nitrisation in this case, but cross-povidone is probably driving it as well. So both of these routes are active in quinapril, would make the most sense to me. And here's another Ofenadrin. This is an extended release as well. Same thing again. Well, there's no immediate release here, but there's ethyl cellulose. It's the same as HPMC in the sense that it is known to generate significant formaldehyde. Povidone, same thing. Lactose, magnesium stearate are not acidic. The drug will not acidify based on its properties at all. It'll only be around pH 7. So this is another case, seems pretty certain to me that it's the formaldehyde generating ethyl cellulose that are responsible. The tablet pH is actually quite high. The last case, this probably never be all put together with what we know now, but this is a case where everything's working against it. There's HPMC, HPC, the capsule shell is HPMC. They also added an acidulant, tartaric acid, because none of this was known at the time. And the mesylate pKa, this is a mesylate, it's very low. It's essentially that has no proton affinity. And if you do the calculations with the pKa and the mesylate, it's going to easily reach pH 4.9. It's got everything. It has low pH for a number of different reasons, and it has these formaldehyde generators. So, they're all contributing. This is breaking news. This data was not published when I wrote the paper. It only came to my attention in the last month. This is a paper in print where this is now real data. I must say that the authors admitted that they were somewhat inspired, probably because of the unsettling feeling that this paper gave them, that they looked at this, they measured this now. This is in this particular frame, I'm capturing the same 1 millimolar log nitrisation rate due to the usual process. And here now is the formaldehyde path at 1 millimolar as well. And sure enough, they cross down here at 5.8. They're actually, similar, but that means up here at pH 6.4, where we're trying to have our tablets at higher pH, yeah, this is the three failures that I'm sitting up here because this formaldehyde line is here. If this formaldehyde line is not here, these would have been down here. So this is to me, the proof that in solution at a similar dilute level, here it is. The formaldehyde can compete just like this. Sure, if you're sitting down here at pH 5.8 or 5.5, whatever, I guess this would be, yeah, this is like pH 5, you will be dominated by the acid pathway. But the problem is that as we try and move our tablet pH high because of this, if we have formaldehyde here, you're setting yourself up for failure in that. Again, these are failures with the old numbers, not the new FDA limits. I don't know if they would have failed here. But the point is, you can see that this is very indicative of what I've been trying to say. So the conclusions for this first paper are, yeah, 3 of these 6 cases look like this formaldehyde generation route to nitrosation might make sense. Unfortunately, I believe it's absolutely operating in our solid dosage forms. I don't think we're going to have any problem if everyone's willing to say, oh, well, we're going to change salt form. We're going to get rid of excipients. You know, if everyone would easily do that, we're not going to have any problems. I think the real problems are going to be that, you know, people are going to say, well, I don't really want to give up this particular salt form, and I don't want to give up povidone. So let's see if we can manage this. So, and you might be able to, you know, given the new limits. But you'll have to go in, you'll have to have a lot of analytical work, you'll have to have a lot of strategic thinking and monitoring as you try and work through and say, yeah, can these be kept given these extra risks? I doubt if everyone's going to dispose of all the risks up front and saying, we don't even want to go there. But this is the choice that we now have, the innovators now have to make. And I don't think we're going to be having a lot of recalls like we did in that earlier time. I think the FDA has given us limits to work with, and I think we now know maybe how to formulate, and we're now aware of some more things. But it is going to take some work. So anyway, that's the first paper.
Thank you, Paul. This is very thought-provoking and useful information. Any questions, William?
Anybody is using like scavenger or something, mixing this during tablet formation?
Well, you know, that's a very interesting question. I've been musing over scavengers, but right now I can tell you that well, what's the best way to say it? I think most people don't believe this yet. I think the scientific community that are really accountable for these things, by that I mean, you know, the guys that are working in industry that are writing these risk assessments, they're not quite believers yet. It's still working itself through the system, so to speak. This paper has just come out, and the guys that wrote it, well, let's just put it this way. This data to me is stunningly convincing, which is right out of one of their figures. And if you read their conclusions, they're a lot less like, wow, this means this formaldehyde path is right than I am. But they do say it. But I'm just saying this is going to take a while to get this to soak into all throughout and have this be accepted that this is something that they need to worry about. But I am convinced it is, and I know I have some connections with certain companies, and they're now seeing this, and so this is going to have to be dealt with. But to your point, I think that's a very interesting question. I would really rather not say too much about that yet, but I have begun to think through just that. But the problem is that now you start thinking about adding something new to your formulation, which you know, that adds another layer of its own risk, and you got to weigh that risk against what is this risk here really, in terms of how the FDA derived these limits. It's a touchy thing, but that's a great thought, and I think at some point it may be considered, you know, is that something that we actually do, and actually put in tablets? Yeah.
It's worth trying it and experimenting and potentially building a model that, you know, you can see whether HPMC and various other things, you know, pushing these different levers, water, nitrite, formaldehyde generation, and potentially another lever would be antioxidant, maybe such as ascorbic acid, a little bit of vitamin C.
Well, you got to be careful with those acidulants because you're going to turn on that acid pathway. So you really got to be careful with that. But yes, and there's been a couple papers out about now can we add things to get rid of nitrite, to react with nitrite. And that looks like that may be a route too, if you can find stuff that you really want to add to your tablet. But that is starting to be investigated too. So I think you're right. There's really going to be a lot of interesting chemistry that can be done. In the end, I think we're going to be fine. It's just going to be a lot more work, and that's what science works with. So
We have another question.
With the sequestration idea, what is the kinetic rate of these reactions? And I take it with the phenomenon of water and everything else, it's a surface phenomenon. In that respect, rate of reaction versus a paraformaldehyde formation. What's the availability of formaldehyde?
Well, I'm not sure I can answer that question I don't know, in any kind of deep way that you're asking. What I can say is there's tons of formaldehyde reactions in the solid state demonstrated all the time, and so I don't know how one wants to talk about how they're happening or how they're not. But for example, the formation of this iminium ion, this is well known to be able to form in the solid state. So if your question is what is the details around how this is actually coming into contact with a secamine, I don't know that I can answer that. I'm sure that in water, I mean, this is in an equilibrium with its hydrated form. I'm not sure. It would seem that the secamine wants this form, but they're all in equilibrium, etc. I don't know how to answer. I don't know that your question has an answer that I can answer in that way. I mean, these things get through these layers and they get into reaction contact with each other. And this is how all degradation occurs in the solid state, everything we've ever seen. So I don't think this is any different. This is probably worse because one of the reagents is a gas, and that just helps it get through the whole thing even faster, in my view.
Paul, you need water for this, chemistry to go through.
Well, yeah, that's sure. That's what this is all about. Meaning this crazy thing with the microlayers. We all have water. Every tablet on the planet is viewed to have some amount of this adsorbed water. I mean, typical KFs are 2, 3, 4% for a tablet. The idea is that I don't know how thick you want to view this layer, but even at 0.5% conceptually, using simple hard spheres, there's tons of water to do a reaction in, even in a tablet. Yeah, this is all this kind of microlayer stuff here. Absolutely. The ranitidine case is one that you're all very, very familiar with. So we'll go through this pretty fast. By the time 2019 rolled along, you guys were the first ones to show, wow, this API alone can actually grow levels of NDMA. And that was the first time that had been shown for any compound in the pure drug substance alone. So by 2020, there was no understanding of how this could happen. FDA recalled it. Since then, a number of reports have gone in pretty good detail trying to figure it out. No one has been able to suggest a chemical path, and ranitidine products remain off the market. I was lucky enough to come along and know a lot about oxidation processes, particularly peroxyradical. When I looked at this in the middle of this whole formaldehyde thing, the two came together, and I was able to propose a detailed mechanism that made sense to me and at least the reviewers, and a simple mitigation procedure comes out of that mechanism. So that story is this talk. So I'll introduce the problem very briefly, and then we'll talk about peroxyradical. It's all about peroxyradical, an application, and apply it to ranitidine, and how to get DMA and the nitrite that is released from ranitidine, how to get them react. That's really the same question we already went through. But in this case, it's the acidic pathway joins these two, and a summary of the mechanism and a control strategy. So this is the question. Here is ranitidine, somehow previously unexplained. DMA is released, if you will, from here, and the nitrite ion is released out of this vinyl nitro moiety somehow, and then somehow the DMA and the nitrite ion get together to form NDMA. This is the usual question of, well, now we have an aldehyde path or an acidic path. It's going to be the acidic path here, but how to get this all done? So the relevant findings of the innovator. So they looked at the known degradation pathways. They couldn't explain it. They said, you know, the NDMA has a time and temperature dependence. Seems like it's a degradation process, right? The role of drug substance purities was examined carefully, and they said no way. And the thing that was really wild is that there's two different crystal morphologies that they identified in their drug substance, and one had big issues with NDMA and the other did not. And these two morphologies absorb different amounts of water and the final isolation solvent on their drug substance surfaces. So it's two different morphologies, two very different results. The other thing is they had data which would suggest that the drug substance grew and NDMA even worse than the drug product, which was kind of unusual in the general sense. So the first thing they did was they were so flummoxed that they could not explain this chemistry that they did a simple labeling experiment where they made, they deuterated this whole N, they put N15 on this. This is a 100% label. And of course, when they heat that, the NDMA has to be doubly to +7 because there's nowhere else for anything to come. So they didn't prove much there. But the point of this was that now they can get this, and they put like X milligrams of that in a certain amount of solvent and dissolved it. Then they got the same X milligrams of the unlabeled material, added that to the solvent, and then co-crystallized that, and then put that up on stability and looked at what was the labeling in the NDMA. And if this was really an intramolecular reaction where this was somehow bending around and having some kind of direct interaction and ending up with this, well, that labeling experiment then would have shown that all the label would have been either +7 or all the label would have been unlabeled NDMA, 50% of each if it was completely intramolecular. And that's not what they found at all. They found the label was distributed basically 25% between 7, 6, 1, and no label, which just means it was a completely unrelated release of this and a completely unrelated release of this. And then they were getting together randomly and the label was completely scrambled. But they had no idea how. So now we get to peroxyradical chemistry. So peroxyradical has two basic types of reactions. So you can look at this as I'm babbling on here. The first one that matters, that it does, is it can abstract hydrogen atoms from very weak CH bonds. When it does that, this peroxyradical abstracts that hydrogen atom and gets to this hydroperoxide, leaves a carbon-centered radical here, then oxygen adds to that, and then you get a peroxyradical back, and this just keeps going over and over. And the extent to which this reaction can even happen, peroxyradical is very selective. So it really has to do with how energetic is this bond, which is typically about 370 kcals per mole, compared to this CH bond, the one it's trying to extract a hydrogen atom from. If this is real strong compared to this, it doesn't react. I mean, that makes sense. If this is weak compared to this, wow, this reaction can happen quite easily. So that's just usually accounted for just in the bond dissociation energy. So below 370, which is this, it will react. Above 370, it reacts slow. So if you just look at those words in a different way, that's just this. Here's bond energies all the way up. Here's peroxyradical sits right in here. So if it has bond energies above this, these things up here don't react. This is slow reaction with peroxyradical. Things that are kind of similar, they're moderate, and things that are way down here that have very low CH bond energy, antioxidants being the lowest. These are really fast. Here it's actually OH bonds donating hydrogen atoms. Point is, down here, things react very fast with peroxyradical. Very few things are down here. So now you look at ranitidine. Previously, it was never able to calculate this bond, but now, post the paper, there's a government-sponsored BDE calculator, Alphabet, machine learning derived fast, accurate bond, and you can load the whole structure in, and it calculates the bond energy to within 1 kcal. Hey, thank goodness for machine and AI-derived learning, huh? So loaded this in to the program, stuck it in, and out came that CH bond energy. It's down here. It is the lowest CH bond energy I have ever seen. It's down where things are typically antioxidants. So the point is, it is very low energy, and its own peroxyradical would have no trouble at all reacting with this bond. 335, very, very low. So if we let a proxy radical approach the left side of ranitidine to this low energy CH bond, well, this is what happens. It goes through the usual peroxy radical thing. Peroxy radical takes that hydrogen atom right out, and this becomes that. This unpaired electron sits here, adds oxygen, and now you have a ranitidine number 1 peroxy radical. That's the first molecule. I'm just labeling it. Okay, and now this does the same thing. So this goes now to the hydroperoxide because it took it does the same thing. So you get a whole bunch of the hydroperoxide coming out, and you're always got this peroxy radical itself running around. So what oxidation products are likely to accumulate longer term from this? This is the first level, slide 1. Well, if you look at anytime you have a peroxy radical, you can get the disproportionation of this radical. For this case, that's the hemiaminal and this amide. So it's all about the hemiaminal here. So here's a ranitidine, here's the other product, the ranitidine hydroperoxide. This can decompose in a lot of ways, and they typically do. This thermalizes across this bond, splits homolytically. This goes to O dot. That's a very strong radical. It extracts hydrogen atoms from anything, goes to the hemiaminal. That's what you would expect it to. This can also eliminate hydroperoxide, often happens. Not a bad leaving group. As soon as you get this, this can react with water, reacts here and goes back to the hemiaminal. So you make the hemiaminal, and there's only one thing the hemiaminal really wants to do, and that's get it back into equilibrium with the amine and the aldehyde from which it can be viewed as coming, if you will. So this reaction just goes boop, 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 off kicks DMA. It is one of the natural products of peroxy radical oxidation on the left side of ranitidine. The other peroxy radical path, unbelievably, is addition to an olefin bond, which happens to be also sitting on the right side of ranitidine. There's an olefin bond. This reaction is extremely well studied and known, just like the other one. So peroxy radical adds to a double bond. When it does so, it leaves an unpaired electron. Now it has a choice. Either oxygen adds very, very fast, which gets you this kind of peroxy radical. This is just oxygen, molecular oxygen adding here. But in this case, this thing can also interact with this OO bond and cleave out an epoxide. So these are two well-known reactions of peroxy radical reaction with olefin. And so there we go. The same peroxy radical, it comes to the right side of ranitidine and does the reactions I just showed. They all lead inevitably to the same thing, the expulsion of nitrate. You can follow any which ones here, given the limit of time, and I know we barely are even doing this particular presentation, so I probably won't go through this, but this is pretty straightforward. Peroxy radical, disproportionation, alcohol, it's all the same stuff. Nitrite will be produced from the right side. So we have independent paths here and here producing nitrite ion, and DMA, just like is needed, explains the labeling experiment perfectly. Now the question becomes, all right, well, how do we get these together in the API to make NDMA? And based on what we know, it's either the acidic or the aldehyde. Well, there's no excipients to produce from aldehyde, but as I showed, a couple ranitidine aldehydes are produced. But if you look at the drug substance adsorbed solvent content, which that paper had, and you calculate the relative concentrations of water, methanol, and isopropanol, there's over 100 mg per mil ranitidine that can get into solution in both of those different morphologies. At 100 mg per mil, that is the pH should be something like 5. Now, some error is in there because it's not 100% water, but 100 mg per mil ranitidine HCl will be acidic. It also brings in, we estimate its solubility is 0.3 molar in those layers. At any rate, it brings a lot of chloride ion in as well, of course. So we also could be enabling the nitrosyl chloride, the NOCl. That's the same as the other nitrosating agent, the nitrous acidium. It's the same thing. The point is, it really argues that the acidic pathway is likely how they're joining. It's also interesting that the NOCl pathway could explain the two different morphologies actually being very different in NDMA formation. I was shocked that I was able to offer an explanation for this. But if it really is the nitrosyl chloride path, well, that's got to be that is an equilibrium with water. This equilibrium constant is known and is published. There's reference for, and one morphology has 8-fold higher water in its microlayer than the other. That's just based on the numbers that they gave and how they absorb different amounts of water and solvent. So good old Le Chatelier, if I'm saying that right, if I have 8 times more water here, I push this to this side in comparison to the other, and that means less yield of the nitrosating agent nitrosyl chloride. And sure enough, the morphology that has 8 times higher water is the morphology that has less problem with NDMA formation. So I was stunned, but yet had to further believe that this is what's happening. I will lay off this bullet given the time. And so here we are. Everything can be explained. Peroxy radical reactions can explain both releases independently from each side. The drug itself is extremely reactive with peroxy radicals by that calculation. Never seen a more reactive one. The independent peroxy radical left and right, yep, did that. The NDMA does have a time and temperature dependence that looks like a degradation process because it is. It is a peroxy radical oxidation process, which has the typical kind of temperature and humidity dependencies. The two morphologies grow different amounts of NDMA due to different NOCELs, from 8 times more water present on one. Gas, we're going to skip this bullet for time. Full chemical rationale appears, and the mitigation procedure is simple. We're on the second to last slide. Well, peroxy radical chemistry consumes molecular oxygen at every step. Without oxygen, none of this can happen. So oxygen scavenging technology for ranitidine, in my view, will completely shut this down. And that's the only thing I think that hasn't been tried. And that's why nothing has worked. So the kind of simple experiments that Emery detailed in 2020, but instead of doing that in the presence of an oxygen scavenger, of course, you got to have a seal on this thing. It's got to be a seal, to keep the oxygen to 0. I'm suggesting will show no increase in NDMA levels whatsoever. Of course, assuming I'm right. And I'd be delighted to help in any way possible. And I think that's it. Yeah.
Thank you, Paul. You've given us a lot of food for thought. Obviously, some of your hypotheses are worth exploring, and we will explore. And for sure, though, there are opportunity for us to do some publications together. In the meantime,
I would really love that. That would be really, really super.
Yeah. In the meantime, if for those of us who are listening to this talk, either through Emery Pharma's website or our YouTube channel, please feel free to contact Emery Pharma by sending us an email at emerypharma.com or contact Paul through his company, his consulting company. Get involved and help you figure out how we can minimize your nitrosamine formation and effectively figure out the parameters of your drug substance, drug product, in terms of what will make it form nitrosamine, and put some controls around your final product. Thank you all for listening, and we appreciate Paul's contribution to this area of research.
Thank you very much. I appreciate it.
Thank you.